Hi, my name is Dr. Christine Estes, and I have been an obstetrician-gynecologist in private practice for over 20 years. While I'm originally from the East Coast, I attended college at the University of Notre Dame, which was my introduction to the Midwest. I then went on to medical school at Georgetown in Washington, D.C., and returned to the Midwest for residency at Rush and decided to settle in the Chicago suburbs. I chose the specialty of obstetrics and gynecology because I love the variety within my specialty. I am able to work with patients in the office and be active in the hospital by delivering babies and performing surgery. Honestly, I am never bored. There is no other specialty in which a physician can build long-term relationships with patients while also being an active surgeon. I feel blessed to care for many women over the course of their lives as I guide them through childbearing years into the mature phase of their lives. It is honestly a privilege. I walk into work each day excited to see patients and ask them about their families while helping them address new issues or concerns that have arisen. I have a real love for obstetrics. Pregnancy is both an exciting and scary time for many couples. I really enjoy guiding them through the whole prenatal experience. In my mind, there is no better job than helping to escort life into the world. Not many people are able to go home after a long day and say, I delivered 3 children today and was able to be a part of a monumental life experience for 3 families. It's still a thrill every time. Also, after 20 years of doing what I do, I feel my skills serve me well, and I know what to do to ensure the safety of my patients and their children. I have a special interest in multiples, twins and triplets, as I am a mother of triplets who just turned 21. It's also very exciting to have a relationship with certain families when I'm able to deliver several or all of their children. And now I'm starting to see some of these babies I delivered years ago as young women in the office. I also have a real interest in health and nutrition during pregnancy and helping patients with this both during and after their pregnancy. My other interest is robotic surgery. Since 2011, I have performed and assisted in hundreds of robotic assisted surgeries. Robotics have really transformed the field of minimally invasive surgery. A hysterectomy is a surgery to remove the uterus and possibly the ovaries and fallopian tubes. There are several conditions that can necessitate a hysterectomy. I feel that minimally invasive hysterectomies, when possible, can reduce complications and speed recovery, and we know that women want to get back to work and their responsibilities with as little interruption as possible. As a doctor, it's important that my patients understand I am here to help them while letting them continue to have autonomy with their care. I want them to be the best version of themselves on all levels. I have a certain set of knowledge and skills with which I can advise them and treat their problems, but I also know when to say, hey, I can't help you with this, but I know someone who can. I want my patients to feel comfortable talking about anything, and I will try my very best to come up with a treatment plan tailored to the patient, or I will point them in the right direction. I do think the doctor-patient relationship is the key to success. If the trust is there, the patient will communicate their needs and concerns in a much clearer way. I've had many patients tell me they are so glad to have met me because they feel so comfortable and confident in my care. That means a lot. Outside of work, I am married to my husband, Chris. Yes, it gets confusing at times, and a busy mom to triplets. I'm an avid runner as I've completed 15 marathons and one Never Again ultra marathon. I also enjoy weight training and my beloved Peloton that helped me get through the early COVID days. Finally, I love traveling and beach vacations. I honestly can't imagine doing anything other than what I do. I am so lucky that I'm one of those people who truly enjoys my work. I love seeing my patients year to year. I love trying to figure out difficult problems. I love guiding my patients through fertility issues, menstrual problems, pregnancy, as well as menopausal issues. Women in many cases are the glue to the family. We have so many demands upon us between work and family that it is easy to put our health on the back burner. I try to remind my patients they need to work and invest in themselves so that they can continue going at the pace they are going. And self-care is not selfish. Recently, one of my most gratifying experiences involved a patient who was referred to me from another physician for follow-up of an abnormal pap smear. On interview with her, I learned she had been short of breath for several days and really had trouble coming in from the parking lot. She had recently been seen in the ER and told to follow up with a pulmonologist. I told her we could hold off on addressing her gynecologic issue and called the ER as well as the pulmonologist. My staff and I then brought her to the emergency room by wheelchair, and she was admitted for 5 days as she had a tremendous amount of fluid on her lungs. As a doctor, I recognize that sometimes the reason for the visit is not the real problem. I am thrilled she is now healthy. She subsequently sent me flowers and a lovely note thanking me for saving her life. She said she had never met a doctor like me who actually listened to her and took time out to immediately get her the help she needed. That was such a heartwarming thing to hear. Knowing that I am making someone's life better is all I can ask for as a physician. Truly, I am blessed.